This is a video in clinical medicine from the New England Journal of Medicine.
Conducting a family meeting is much like other medical procedures. It requires clinician training and a structured approach. In this video, we demonstrate a flexible framework for leading a family meeting and show examples of useful approaches and techniques for communicating with the family about serious illnesses. The key functions of a family meeting are to build rapport and provide support, provide updates about a patient's medical status, discuss prognosis, and ensure treatments are consistent with the patient's goals. The steps of this framework include preparation, introductions, and agenda setting, discussion of the patient's status and prognosis, clarification of the patient's goals, discussion of treatment options, summary and discussion of next steps, and debriefing and documentation. Prepare for each family meeting by first identifying agenda items for the family meeting.
Can we do a quick pre-meet for the Rivera meeting?
That'd be great.
Thanks.
Okay. I'm hoping to not make any decisions necessarily, but just to give them some information about what's happening, our concern about mental status, and that we're really worried about her not waking up. What do you both think would be good outcomes for the meeting?
Next, review the clinical data, including the current medical status of the patient, the prognosis, the treatment options, and any wishes, treatment decisions, and surrogate decision makers that the patient has previously documented in healthcare directives.
I heard she had an advance directive. Is that right?
She does have an advance directive, and she's identified her husband, William, as her surrogate decision maker.
Okay.
Also discuss who should be at the meeting and where the meeting is occurring.
I know he's particularly concerned about her mental status.
Okay.
And I'm wondering if you feel like it would be helpful to have neurology or any of the other consulting teams at the meeting.
I talked to neurology. They're not able to be here, and they gave me an update that I can share, which is that there's no change in their assessment and no change in their exam from this morning.
Begin the meeting by asking all participants to introduce themselves and explain their roles or the relationship to the patient.
I'm Anne. I'm the social worker on Angie's team.
Hi, Ann.
I'm Wendy Anderson. I'm her primary doctor.
Okay.
I'm Kathleen. I'm Angie's nurse.
And I'm William, Angie's husband.
I'm David. I'm Angie's son.
Next, state the agenda for the meeting and ask family members what they hope to accomplish in the conversation.
The first thing that we wanted to clarify is that the purpose of this meeting is for it to be useful to you. So we want to make sure that we give you information that you want. For us, it'll be really helpful to learn more about you and about Angie.
Okay.
Could you please tell us before we start what would be most useful for you to get out of this meeting?
I guess to figure out what's going on. I flew in.
Yeah.
I'd love to find out how this all came and started from pneumonia.
One main goal of the meeting is to elicit family perspectives and views, so families should have as much time to speak as clinicians have. The ask-tell-ask communication technique is a useful method here. First, ask family members to describe their understanding of the patient's illness, prognosis, and expectations regarding current treatments.
I'm wondering if this is an okay time to talk about her medical problems.
Yes.
Please.
Can you tell me what you've heard so far?
I've just heard the recent news that the complications from pneumonia has caused an infection in her lungs. If you could express a little more in detail as to what's going on there.
Got it.
Next, clinicians share their assessment of the patient's status and prognosis. Focus on the larger picture of how the patient is doing rather than providing a detailed summary of medical information.
And then the reason that she's in the intensive care unit is that she had a cardiac arrest. That means her heart stopped. Our biggest worry at this point is that she sustained an injury to her brain from the time that she wasn't getting blood to her brain during the cardiac arrest. And that she may not return to the person that she was before she came into the hospital.
Then elicit family questions and assess the family's understanding of what was said.
David, I know that you're just hearing this for the first time, and did what I said make sense? Do you have questions about it?
It made perfect sense. I'm just worried about her mental state now that you mentioned that her brain's been affected. I mean, part of what defines her is she's a pretty sharp woman, so it'd be nice to know that she can retain that when this is over.
We're worried about that as well.
When difficult news is shared about the patient's status, acknowledge family emotion by naming and validating those emotions, stating support and respect for the family, and asking the family to say more about how they feel.
You don't know her like I know her, and she's pulled through worse.
You both are in such a difficult position. I can't imagine what you guys have been going through as a family.
Using I wish and I worry statements together can be a useful technique for clarifying concerns about outcomes while maintaining alignment with the patient's and family's goals.
So, David, I wish that we could say that it was something that we were doing that was making her like this. What our worry is that her brain's not working the way it used to.
After discussing the patient's medical status and prognosis, and before discussing specific treatment options, clarify the overall goals of care. It may be helpful to first explore who the patient is as a person.
I'm wondering if the two of you wouldn't mind sharing with us a little bit more about who Angie is and what life was like before she came into the hospital, before she became sick.
She's involved in our church. She's a Sunday school teacher for the kids. She's done that a number of years.
Explore what quality of life means to the patient and any previously stated preferences for care. Some common goals are spending time with family, returning home, and living as long as possible.
I'm wondering if Angie were at the table with us right now, what would she tell us about what she's hoping for?
I think David is right in that she wants to be with her family and preserve her dignity.
So from your perspective, she would be worried about treatment that won't get her back to where she was.
Exactly, the quality of life that she's used to.
The next step is to discuss specific, reasonable treatment options. Before making any recommendations, summarize the hopes, worries, and the things identified as important for the care of the patient.
So, David, I'm hearing from you that first of all, more time is really important.
Yeah.
I'm also hearing that, for your mom in many ways, being alive in itself is something that you feel like she would think is really valuable.
Yeah, for sure.
I'm hearing you both say that being out of pain is important.
Yes.
And then, William, I'm also hearing sometimes that she talked with you about situations where she wouldn't want her life to be prolonged.
Yeah, I think if it turns out that she's in a vegetative state, she would not want to continue her life.
Then discuss specific reasonable treatment options that are aligned with these goals. It is often helpful to then offer a recommendation.
So, William and David, based on what I've heard from you about what's important, may I suggest a plan for the next few days?
We're ready for that plan, sure.
Okay.
Conclude the meeting by summarizing areas of agreement and disagreement, reviewing decisions that were made, and discussing next steps, including establishing when a member of the team will check in with the family and timing for the next family meeting. Be sure to provide available written materials and contact information. Lastly, acknowledge and thank the family for participating in what is often a difficult discussion.
You both are in such a difficult position, and I just want to acknowledge how lucky Angie is to have you both by her side and advocating for her and making sure that her voice stays central as we think about these next steps in her care.
All right.
Thank you.
Follow every meeting with debriefing and documentation. Clinicians may feel pressured to disperse quickly. However, a good debriefing session can be as short as 1 minute and serve several functions. Debriefing allows the medical team to reconcile different perceptions of what occurred during the meeting, to review changes to the treatment plan, and to provide feedback on what went well and things that could be done differently next time. Debriefing is especially important for trainees, but even experienced clinicians can benefit from feedback.
Thank you both for coming and sticking around to talk for a few minutes. I was hoping we could at least touch base together and think about how that meeting went and what we want to think about the plan is moving forward.
Yeah. Sure. I think we learned a lot about the priorities from both David and William as far as comfort, family time, spiritual support.
I think I'm just not sure about whether David will, with some time, come around or, to seeing things differently, or whether this is really how he feels like his mom would feel. And I feel like that felt a little bit strained in the meeting.
Document a summary of the family meeting in the patient's medical record so that other clinicians who weren't present at the meeting are aware of everything discussed and any decisions made. Using a structured approach throughout these regularly scheduled meetings is key to achieving patient and family-centered care for seriously ill patients.